everyone, I'm Dr. Stephanie Kamaya Reznick. I'm a board-certified internist and one of the medical directors for virtual primary care here at Oscar. In today's video, we'll be talking about sexual health. It's an important topic that can affect having healthy relationships, ensuring that pregnancies are planned, and avoiding catching any infections. My first tip is before engaging in sexual activity with a new partner, make sure to talk to them. You should discuss how many past partners you've had, if you've had any prior STIs or sexually transmitted infections, and if you've engaged in any drug use, especially IV drug use, as that's a risk factor for having HIV. I also recommend that you and your partner have recent STI testing, as you might not have symptoms, but still be able to pass on an infection. I also recommend that you use dental dams and condoms with all of your partners. This will decrease your chance of catching an STI. Also, remember that drinking alcohol or using drugs would decrease your ability to inhibit your behavior, and you might end up engaging in high-risk sex that you otherwise would not have engaged in. Make sure to pay attention to your body and your partner's body. Look for signs of potential infections, such as rashes, blisters, sores, or discharge. Again, many people may be asymptomatic and still pass on infections, and this is why routine STI testing is recommended. If you're a woman with an intact cervix, remember to get your pap smears and your regular pelvic exams as recommended by your gynecologist. If you know you're likely to engage in high-risk sexual behavior, talk to your primary care provider about PrEP, or pre-exposure prophylaxis. It's a medication you can take that will decrease your risk of acquiring HIV if you do participate in high-risk sexual behavior. I'd also like to talk about sexual health in the setting of COVID-19, which adds another layer of risk. The coronavirus can be passed through saliva, such as through kissing, as well as microscopic fecal particles, which you may be exposed to during oral or anal intercourse. For this reason, it's recommended that you use a dental dam or condom, especially right now, as it's an extra layer of protection against COVID-19, in addition to more traditional STIs. During the pandemic, make sure that both you and your partner feel healthy, so you're less likely to pass on the infection. But keep in mind, like with traditional STIs, someone may be asymptomatic but still carrying the coronavirus. If you have a sexual partner, I encourage them to be considered part of your pod or extended household so that you can limit your overall exposure. You're not just exposed to your partner, but whomever your partner is exposed to as well. I hope these tips were helpful. Stay healthy, and I'll see you next time.